talk about as a doctor, as a medical doctor, you went to medical school, you went to Meharry. Did you go to Meharry?
Yeah, I went to Meharry Medical College
Okay.
in Nashville. Yep.
Okay, which produces more Black doctors than any other school, I think, in the entire world, maybe
Yes.
outside of Cuba.
Oh,
I want to
Cuba.
give them. I want to give them that. Why did you go to medical school before we get into your personal story?
I went to medical school because I wanted to. I had this whole romantic idea that doctors could save the world and heal people, and I was going to get a magic wand. I was 8 when I made that decision. And so I suffered from asthma a lot as a kid. And when I got sick, in my mind, it was the person who came in a white coat that made me feel better. I know they were probably giving me medicines, but in my 8-year-old mind, that person was healing me. So I wanted to be a person who healed other people. That was my mindset, and that's why I went to medical school. Once I got to medical school and matriculated through, I was like, "Woo, child, it's more than just some white coat and magic. This is some stuff." But I still wanted to see people whole and healthy.
All right. So, did you have a particular role model? Because for us to just to imagine being a doctor, the doctor that helps you navigate your asthma, was that a person of color? Was that a Black person?
It wasn't. It wasn't a person of color, but I have a lot of medical doctors in my family. So I have medical doctors and dentists and PhDs and thinkers and bishops and people who are just really there to help the world heal. And my goal was I really wanted to help the world heal, not get on a bunch of pills. And so that helped my transition out of medicine when I was like, yo, we are not helping people heal. We are drug dealers. We are legal drug dealers. And so I, oh, did I cannot say that? Well,
Yeah, you said it.
okay.
Is it
I
is it
can't
the
take it
truth?
back, but that's my
Is it the
truth.
truth? Okay,
That's
well
my
then
truth.
keep talking.
So that's my truth. So my truth was I felt like I was just giving drugs to everything, and I was pushed toward giving drugs to everything. And I was like, this is not really helping this person heal. What'll really help you heal is if you just get away from that girlfriend you got. That's why you having problems sleeping and all this other drama. It's not, I don't need to give you a pill. You're not depressed. You don't have, like, you could clinically do all of this. But if I remove this woman from your life, or if you remove this woman from your life, I bet you're gonna sleep better. Let's try that first before we do the pills. And it was working. But you're not rewarded for not giving medicine. You're
Right.
rewarded for giving medicine.
Wait,
Clearing
so
out stuff.
so how are you rewarded are you giving bonuses and stuff?
You're
What?
not necessarily giving bonuses, but it just requires more work to actually have a dialogue with a person. So if I have 40 people in queue waiting to be seen, and let's say I got everybody on here in queue, and I'm taking too long with Tonya Pinkins, and she's asking me questions, and we're having a dialogue because I'm really helping her, da 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 da. But you have somewhere to be, so you like, I need her to hurry up. It's easier for me to say, okay, well, Tanya, here's your thing. Okay, come back and see me in 3 weeks. Well, I wasn't doing that. So you kind of get dinged for having people wait, not getting them in and out. So that's how you are. A better word is dinged or not rewarded for being
Okay.
quick and moving fast and writing drugs and sending referrals and
Yeah, it's
Was
like the
there
patients now belong to the hospital and they give you a certain number of minutes that you have to move them through because they're
right.
not your patients anymore.
No, they belong to the hospital. You really, and I know this is gonna offend some people, but I'm a doctor, so, and I was a doctor. I'm still a doctor, but 25 years in the game, so I can say this freely. Most doctors are high paid workers. You don't run anything. You're not making any decisions on anything. There are the hospital administrators, and I know that we didn't plan on going down this avenue, but since I was driving the car, I thought I'd make a stop in the convenience store and we all get out and get sodas. But that's really
no
what this is.
sodas? We're not getting
Okay,
sodas. Let's get
but I don't
coconut
even
water.
drink
It's fine.
soda, but I just
Right.
use the analogy. But the whole thing is doctors work for the hospitals and the administrators and business people run the hospital. And your job is to check the boxes and look important and be the first one blamed if something goes wrong. Because the community doesn't see that. The community sees the doctors as the front line. Oh, y'all making all that big money, so y'all must be in charge. And that's not how it is. But we're the first one to get punched in the face. We're like the security guards for everybody else who's in the back office making a decision.
And this is
So
capitalism at work. And then
Yep.
doctors
yes.
have to spend some money for somebody to just call the insurance companies to get maybe a third of what the insurance company is going to deny.
Exactly.
So how do we navigate? Because this is Wellness Wednesday. Dr. Jeri A. Dyson is here. Tonya Pinkins is here as well. It's Karen Hunter Show. How do we navigate our, like infant mortality, Black women die, it's like we, as Black people, I feel like we are really struggling in terms of healthcare.
Right.
And then coupling this with what you're saying right now, what advice do you have for us advocating for our own health?
So I want to give a quick snippet of my story and how I got diagnosed with multiple myeloma, because this is going to be applicable to the question you asked. So when I was diagnosed with multiple myeloma, I didn't really have any major signs and symptoms. I just had bone pain. And so when I went into the emergency room, I was having I had a snap and a pop that left me debilitated on the bathroom floor for like 3 to 4 hours.
Where was the snap and the pop? In the leg?
The snap and the pop was in my lower back. So my I was about to say L3, like it's a bunch of doctors. Please forgive me. But my lumbar, okay, so put your hands on your hips. So where your thumbs join together in the back of your spine, that's more than likely your L3. That's the part of the vertebra down, the L3, the number. That's the one that popped. That vertebra or that bone is responsible for, so it was a break in my spine. That part is responsible for lifting your legs up, for sitting up, for coughing, for twisting, for doing everything. So when that pop happened, it was actually my spine broke in that area. So not only did I have a spinal break there that landed me on the floor for 3 hours, I also had pain on the side, but I was like, oh, I've been exercising, running, so more than likely that's what's going on with me. But I had a broken rib fracture, and I had another thoracic, which is higher up, like kind of where your breast would be. I had a thoracic fracture. I'm trying to use a regular word.
Yeah.
So I had a spinal fracture, 2 spinal fractures, one at the bottom broke completely. So that's when I was on the floor screaming and having these electrical pulses going through my body. Just electricity from the waist down, okay? Get to the emergency room. Of course, I didn't want to call 911 because that's a long story. I was butt naked because it was the first thing I had gotten out of bed, on the floor, no clothes. I don't want 911 to call. Do not call 911 because they're going to take me as I am.
Right.
I didn't want that. So I was like,
right.
Let me just take some medicine and get some clothes on. So I'm trying to get clothes on. We finally get to the emergency room, and the young lady who sees me, and I've had a whole dialogue with the hospital since. This was not my hospital that I work in. So this is the hospital.
You're a doctor,
but
you're going to a hospital, but it's not your hospital.
It's not my hospital, Karen. So I go to the hospital. They see what? A Black lady. They don't see a doctor. They don't care. They see a Black lady. So when I get to the emergency room, how significant it is because the people who were in the waiting room, who had been waiting for hours before, when they saw me come in, everybody was like, you need to take her first. Ooh. So they could see the way I was moving that I was in pain. So they were like, move her in. The nurses at the triage were fine. They were like, she's in pain. Something's not right. They moved me to the back. The young lady who is responsible for making the decision comes in. She does an exam. I said, I'm in pain. I am a medical doctor. So most doctors, especially Black women, don't like to start out with, I'm a doctor. Because people like, don't nobody care you a doctor, you a patient. So most of us don't lead with that foot. But I had this little dialogue with this young girl who could probably be one of my residents or a fellow or somebody that I would have trained, right? Comes in and says, oh, so tell me what's going on. I give her the brief synopsis. I think I have a spinal fracture. I'm having some pain. It's shooting down. She does an exam with me sitting in the wheelchair. That's not ample, but I'll keep going on with the story. So I said, I'm a doctor. Would you mind doing an x-ray? I've been a doctor for 20 years. You could probably Google me and look me up. I'm a certified physician. I need you to do an x-ray. She was like, oh, no, I talked with the attending who did not come and see me, by the way.
Oh, this is angry.
Come and see me, but that's why I'm telling this story, because I want the audience to know, your listeners to know, this can happen to anybody. So the young lady says, oh, I talked with the attending. Usually it's an attending to attending. That's like you as a professional saying, an intern coming to you saying, well, I spoke with the other, producers and showrunners and they decided da 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 da. And you're like, why didn't they call me? So I said, this should have been an attending conversation. But when you're in pain, when black people go to the hospital, community's expectation is we about to raise the roof. We about to raise hell. I'm about to be flipping over gurneys. Da 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 da. I need to get some attention. But because I didn't have the energy, the power, or the wherewithal to do that, I needed her to just realize I am in pain. Take me for my word. Can we do an x-ray? She said no, but we can send you home. An x-ray is like maybe $12 max. Just the x-ray. They would have seen I had holes in all of my spine, all the way down, holes. Because the diagnosis that I got, multiple myeloma, it eats away at the spine, inside all of the bones, but it likes the short bones more so than long bones. So my spine all the way down had holes in it, looked like Swiss cheese. She could have easily seen that on x-ray. So I had to go home with ibuprofen, acetaminophen, and oxycodone. Just take it around the clock, it should clear up in a while. I was like, okay, this is what we're going to do. I got on the phone. I started texting my other black female physician friends who were in the area, because remember, I was working at a military hospital, which limits my access and wherewithal and knowledge of people at other hospitals. So I did the girlfriends thing. Hey, y'all, I need a doctor. Not everybody, but I just called the ones that could kind of keep it under wraps. Get me into an orthopedic doctor who I can figure this out. And that's how it happened. And I kind of got backdoored into medicine. So imagine I'm a doctor. Imagine people who don't know or have anybody to call to do that. That's how people
they're home and they die, right?
May I tell a story too? Because you were talking about birth. So when I was 19, I was traveling from New York to LA working, and I kept losing the ability to walk and ending up in an emergency room with this pain in my pelvis. And nobody ever knew what was wrong. And it happened in New York. It happened a couple of times in LA. So finally, one day it was so bad, I went into the hospital and they said, you're probably having an ectopic pregnancy, and I need you to sign for there to be 3 operations done. I don't know which one I'm going to have to do, but it's emergency. You need to sign for all these things. I'm 19. I don't tell anybody. I'm scared. I'm pregnant. And so he says, but I won't cut you unless I have to take your tubes out. So he said he's got to do a laparoscopy and all, the tubal, this. I wake up in recovery. I am cut from hip to hip. No one came to see me for 3 days. I'm 19 years old. I'm laying in the hospital thinking they have taken my tubes out at 19. 3 days, no one came to see me. I had a black nurse. I asked her to please just read my chart because I can't even sit up. She never came back to my room. So, I'm just terrified. So 3 days later, finally, the doctor shows up and tells me that I had a cyst, something that was never, ever mentioned to me. But that's what it turned out to be. But, so I'm just grateful that my worst fears for 3 days had not happened. And that was the decision for me. I will never come back to a hospital, even to die. Something have to be broken and they got to sew it back on. And that's why I had all 4 of my children at home.
So what do we do, Dr. Jeri? And before we get to what do we do, how are you? Multiple myeloma, I know several people have had it. It is very aggressive. Being a doctor, you always how do you get something like that? Like you said, being a vegan, doing, working out, you exercise, you have great spirit. You have a great spirit. I know that personally. How do you work through this diagnosis, and where are you right now with it?
So you work through it one day at a time. I did my learning curve was very steep because, again, I'm adolescent medicine. Multiple myeloma is usually older. But when I was in medical school, it was older white men. I was like, oh, I know you lying. I definitely don't have multiple myeloma being black and a female, and I was 40 something. Child, please go back again and look for something else. And so that my attitude, I had to be positive. I had to bring people in. I did a strict cleanse because I already ate well, exercised, did everything. And so then I was like, okay, I need to figure out spiritually, is there anybody that anybody or anything that I'm holding on to emotionally and spiritually that may affect my body negatively? And so I had to release and forgive and whatever, even if I had a conversation with them or not, I just was releasing people. But then I also realized there was a great amount of trauma that I experienced as a physician in tandem with my patients that I had not released. So when my patients came to me, I practiced all over in Florida and Detroit. And so I would be given the most extreme cases that other people basically didn't want to work with. Patients who were either runaways or transgender or whatever it was. If it was something that other people didn't want to deal with it, they'd be like, "Oh, Dr. Dyson has a way with those kind of patients. Give them to her." So kids who had been date raped, who had been put out of their homes, experience that. And what we realize, even as journalists, teachers, doctors, social workers, ministers, is that the trauma that our people bring to us, we can sometimes embody that trauma, because it's like you're going with them into that space of what they, just like when Tonya was telling that story, I'm thinking, I'm trying to solve this in my head. And so I think I was embodying the trauma without releasing it. It's almost like somebody puts a burden on you, you take that burden and say, "You go heal." But nobody was doing that for me. So then I had to start doing that for myself. So that has been my journey since my diagnosis, February 5th of 2018. So then I went through bone marrow transplant, transfusions, having to have the whole isolation, the pre-COVID isolation before COVID even hit. I was in major isolation after a bone marrow transplant. Because you can't be around anything. No kids can come over. No plants. It's a bunch of no's. The list of no's, it was very long. So I just enjoyed a lot of video and telephone calls and crazy movies and just stuff to bring my spirits up. Now, there's some stuff that's out of my control that I don't have any, wherewithal on. Just like when I was sharing with you how my labs had come back and they were all funky and all over the place. I was like, well, it just is what it is. I'm going to have to deal with it and keep that warrior mentality. And I'm not necessarily fighting cancer. I'm fighting everything in my life that doesn't belong. So people who don't belong, jobs that don't belong, relationships that don't belong. If that's what I'm fighting, not so much cancer. Because for me, I think cancer for Jeri Dyson was something that lifted up every smoke, all the mirrors and stuff. And it helped me to really focus on what was significant. Kind of like Nanny McPhee. You remember that movie, Nanny McPhee?
Yes. Yes.
Okay, so remember how Nanny McPhee told the kids, she was like, "When you need me but no longer want me, I'm going to be around. But when you want me but no longer need me, that's when I'll leave." And I was like, that's like cancer. When you need it to help you get focused on what's significant. So that's why when we're on Nubia and people arguing about, no, Karen's it's eggplant color. No, it's purple. It's violet. That's a deep indigo. Child, boo, it's all of that. Let's move on to something that's significant. So it helped me to really focus on the stuff that we are majoring on. It's not major. So that's why my whole cancer journey has been welcoming to me. Like the job, I was like, I'm stressed at this job. Why am I commuting an hour and a half and then getting to the place and can't find a parking space and all this? I ain't doing this. Bye. I'm about to live my life. And so I think that for me was a liberator versus, oh, cancer. No, I wasn't like that. So it's helping me to recalibrate again. That's how I look at it.